very good morning to all of you. On behalf of the Pop Council Institute, a very warm welcome to all of you and thank you for taking out time for this technical session on health and climate. We've all gathered today to participate and celebrate the Pop Festival for Youth-Led Climate Action. I'm Ashita from the Pop Council Institute and I will be navigating you today for the next 1 hour. We have something interesting and engaging discussions from our speakers, esteemed speakers, and some young youth participants who will be coming forward here and sharing their experience and journey. Before we get into the details of our session, we would all like to congratulate Dr. Pachauri for the book launch event and wish her all the success from the Pop Council Institute. Thank you for setting the tone for our session today, Dr. Pachauri. Before we get into the details of climate and health, let us now see a short video on climate and health, introducing the technical session.
A fortnight ahead of COP27, a new Lancet study claims that anthropogenic climate change has resulted in heat deaths, hunger, heat-related illnesses, and infectious diseases. 98 million more people worldwide reported moderate to severe food insecurity in 2020 than the average in 1981 to 2010. Vulnerable populations faced 3.7 billion more heatwave days in 2021 than annually in 1986 to 2005, resulting in heat-related deaths increasing by 68% between 2000 to 2004 and 2017 to 2021. Period of malaria transmission increased by 31.3% and 13.8% in the highland areas of the Americas and Africa from 1951 to 1960 to 2012 and 2021 respectively. The likelihood of dengue transmission has risen by 12% globally between 1951 to 60 and 2012 to 2021. In India, heat-related deaths increased by 55% in the period of 2017 to 2021 as compared to 2000 to 2004. A loss of 167.2 billion labor hours due to heat exposure led to an economic loss of 5.4% of the GDP. Dengue transmission months rose to 5.6 months, 1.69% increase between 1951 to 1960 and 2012 to 2021. Infants went through 0.9 more heatwave days per year, while adults over 65 experienced 3.7 more days per person compared to 1986. An increasing reliance on fossil fuels 3 decades after the signing of the UN Framework Convention on Climate Change is intensifying the impact climate change has on human health. Presently, renewable energy contributes about 8.2% of the total energy source globally. Moreover, a struggling healthcare system has been knocked down by the COVID-19 pandemic. Out of 95 countries reported, only 60 reported a high to very high implementation status for health emergency management in 2021. Coverage of climate change and health reached record levels in 2021, especially at the 2021 UN General Assembly debate. The report said that there is clear evidence that immediate action could still save the lives of millions with a rapid shift to clean energy and energy efficiency.
So as you all have seen, climate and health is deeply interconnected. It is the relationship between Earth's climate and the well-being of individuals and communities. It encompasses the direct and indirect impacts of climate change on human health. It involves one and all. Each and every action by all of us is somewhere or the other related to climate change and in turn our mental health, health equity and general quality of life. Addressing the health impacts of climate change requires a comprehensive and collaborative approach that involves not only the policy-level public health measures, sustainable development practices, and global efforts, but an effort by each and every one of us. It involves all of us. Hence, the topic today is deeply connected to all of us in various capacities. We've broken up the next 1 hour in 2 sessions. First 30 minutes, we will have a panel discussion by our esteemed speakers. followed by a short quiz and some experience sharing by our youth speakers who've come here from across India and are actively working in the area of climate change and health. Without further ado, I am now inviting Dr. Deepshika Sharma, who is the chair for the panel discussion today. Dr. Sharma has joined Population Council as Director, Climate Sciences. Prior to this, she has served as Climate and Environment Specialist at ICIMOD, a regional intergovernmental organization. In 2023, she also took on the position of Action Area Coordinator for strengthening global leadership in sustainable mountain development at ICIMOD. In this capacity, she has led initiatives in policy and investment advocacy for mountains, engaged in science diplomacy, developed a regional investment framework, and established an Investors Alliance for Climate Action. Her prior experience includes working as a water and clean tech expert at Trade Council Denmark. She holds a doctorate in natural resource management and has contributed to publication of more than 20 articles. We are very happy to have you with us today, ma'am. Please welcome on stage. Over to you now.
Hi, thanks so much, Ashita. And and a very warm welcome to all our young climate supporters here, and who will be, moving on to become more advocate of climate and environment safeguards. I would just like to say that we are looking forward to a session which will be a little bit formal as well and a little bit technical. So if you have any questions at the end of the session for the first panel discussion, you can definitely raise your hands. And we'll also, like Ashita mentioned, we have a very short quiz, and which will be on Mentimeter. And in case you don't have any mobiles, we'll try to see how we'll work on it. So now, without much delay, I would like to invite for one of our esteemed guest speaker and panelists, Dr. Vidhya, on stage. She is an occupational hygienist and climate change scientist, engaging with an interdisciplinary group of researchers to establish a connection between heat workload, dehydration, and renal health. She has completed, thank you ma'am for joining us today. She has completed 6 international research projects and 7 large-scale epidemiological projects on occupational heat stress and health, which were funded by international organizations. She has collaborated on specifically on heat research initiatives with scientists across the globe, and also a key member of the Hot HAPS research group, which she has worked with 108 different industries and successfully intervened to improve engineering management and the personal safety of workers from occupational exposures. And the team's heat stress prevention guide has been adopted by 350 companies, I would say, in India and also in the Middle East. A big round of applause for Dr. Vidhya. Now I would like to invite Sri Nand Kishore Agarwal, who brings over 25 years of expertise to sustainable development. And until recently, he was also one of my, I would say, supervisor as well as my colleague at International Center for Integrated Mountain Development and leading green and resilient mountain economies. So he has spearheaded several multi-country initiatives in diverse areas such as climate change adaptation, resilience building, landscape conservation, and entrepreneurship development. With his leadership roles at international organizations, funding agencies, and across, he has envisioned and executed several multidisciplinary and multi-country research policy and implementation projects across, specifically like India, Bhutan, Bangladesh, Nepal, Myanmar, China, and others. He has particularly focused on crafting solutions for specifically and resilience building for the natural resources across. Currently, he serves as a Chief Technical Advisor for the Indo-German Forest and Biodiversity Management Project under the Government of Nagaland, India. Additionally, he actively contributes to various other projects on sustainable development, including natural farming, to foster positive environmental change. A big round of applause for Mr. Nand Kishore as well. Hello. So thank you so much for joining with us today, ma'am. Just on starting this, and since we have a very young audience, I would request you to keep it like breaking it down and keep it simple. I know it will be a little bit difficult as well, but knowing your experience, I'm sure you'll be able to manage it. So just on in terms of direct health impacts, when we look at, how do you see, and your extensive research on heat waves, etc., how do rising temperatures directly affect human health? And what are the specific health conditions are associated with extreme heat events? If you can just highlight those.
Thank you, Dr. Deepshika, and thanks for the invitation. And it's my pleasure to speak to the young crowd here. I speak to college students, so I'll try and tone down as much as I can. Direct impacts of heat. Heat forms the basis, temperature forms the basis of every living organism on Earth, right? And if you want to say, what's a hallmark of any physiological response when somebody is exposed to heat? There is a change in temperature that happens at a skin level to start with, then it kind of deepens down, and then there is a response for any action, right? There is a response for any action. And then there is a thing called vasodilation that happens, and the blood starts to flow from inside of your body when your internal body temperature rises to the extremities, that's your skin, to kind of cool yourself down. So that if that system fails or that system gets imbalanced, then it starts to show changes in your health. It could be heat rashes, that's a continuum. It's not you get exposed and then suddenly people die, or suddenly people get a heat stroke. It's not like that. There is a continuum depending on the temperature that happens inside the body. For example, in very simple terms, I want to tell to the school students, your body temperature is expected to be 98.7, correct? We all know that. And then if it is 99.7, what is it called? It's called fever, correct? And then if a person who is kind of walking, running, jogging in heat, or somebody who is working in heat, I go back to always the workers. People who are working in heat, and this is not a luxury, they have to do it, their jobs, right? And then their body temperature continues to rise. Some of them even have 101. It's not that they have an infection or something, but they have, the body temperature rises. This is a physiological response. Any body will react. This is how it reacts. Once this happens, they are in a state of fever, and people are working in the state of fever. People are jogging in the state of fever. People are affected because of this. If it reaches 102 or 103, it could be heat stroke depending on the susceptibility of the person. If the person has some comorbid conditions like diabetes, hypertension, or other diseases, they might be affected much more than a fit marathon runner, right? So this is how, and there is a continuum, like I said. If it's 99.7, it could be like heat exhaustion, heat fatigue. It could be 100.1, it could be something. So there is a continuum of heat effects that can happen because of, those are the direct effects. And when you speak about direct effects, there are other things that happen. And it's all based on the thermoregulatory mechanism of the body. And if you stop sweating at 103 degree, then you get into a state of heat stroke. So recognizing what happens to our body and trying to prevent ourselves before it reaches that 103 or 104 is what is the key. So when you say just heat, that's what directly happens. In a very simple manner.
Yeah, thank you so much. And I think, thank you. And I'm sure students are listening, because we will have a quiz after this. So I'm just preparing all of them. Right, but yeah, it's very interesting to know about the variations, especially like especially the last part what you mentioned about the sweat part, that if you're not sweating, and then it's kind of a heat stroke situation. I think this is something to really, at least for me, to learn from this response. So thank you so much. Now moving to Nanji. So in terms of community, like how to cope with such situations, since you have your expertise in adaptation processes, so how we can have the community-based adaptation approach approaches, you know, actively participating in these developmental aspects and implementing strategies. Any examples or case studies around it would be helpful to the coping mechanisms and resilience building. Thank you.
Thank you, Dr. Deepsika. Before I answer that question, let me first express my gratitude to Population Council colleagues who reached out to me to be here at this prestigious event. I'm also deeply honored to be speaking in the presence of Dr. Saroj Pachauri, whom I have heard about, and of course, working in climate change, I've always knew about Pachauri family, who is contributing so much to the climate discourse. And more importantly, I really want to shout out loud for the POP movement social media team, because just a few days ago, I was pleasantly surprised to see a social media post on LinkedIn with my name in it, and the team really looked into all my posts in last 2-3 years and picked up a particular post which was relevant to this particular event to say that this is what our leaders are saying. And this was really, so please give a big round of applause to POP movement and social media team of the thing. Now, this workshop could not have come at a more opportune time, because the book launch just we saw, and just 2 weeks ago in Davos, World Economic Forum, really have come up with a big report on quantifying the impact of climate change on human health. So this is also, and they have given all the big figures, numbers, how it is impacting. So I hope that countries and governments will really take the efforts forward. Trying to answering this question, I was just thinking how to make it simple, and let me just go back to my teenage, when I was a teenager just entering undergraduate studies, and many of you are already undergraduate. You would have seen the examples when you walk in a class and suddenly teachers gives you a quiz, unannounced quiz, and you all feel, oh my God, what is this? How do I answer this quiz? I have not prepared for it. But my teacher asked a question saying, please describe why prevention is better than cure. And it was a common sense question, it's important, and it was in the say context of animal diseases, because I was an agriculture student, and then we all struggled, but we tried to answer, just using our common sense, that why prevention is better, and we answered, and most of us got reasonably good grades. That moment stuck in my life that, okay, we need to do work in a way that we don't get into troublesome situation. And that time climate talks were going on, and it was not picking up, but there was still a report. And just 2 years ago, I read a report which was published 30 years ago. They said the same thing. We are still talking about the same thing 30 years later without much action. Why the action is not happening? This morning we saw such a inspirational talks about why action is not happening and why it should happen with us. So what I'm trying to say here is that it's very important that each one of us try to prevent reduce the impact of climate change by our own actions, and we can do that very well. A specific example of climate adaptation, I'm not a health expert at all. In fact, I have never worked in health sector, but I have worked in, say, food production sector, agriculture sector. So there is a group of around 60-70 villages near Kathmandu, which produces vegetables, and they sell it to Kathmandu city, which is the biggest city of Nepal. And this group, and they sell it to the mandi, big mandi with like our Azadpur mandi of Delhi. So they have a big mandi where this comes. And with the changes in the temperature and rainfall variations, lot of new insect pests started coming in. This has become a common knowledge now that and Dr. Vidhya is here, she can describe it much more. When temperature rises, new kind of insects, pests, and much longer, you saw in the video, much longer dengue period is there. So new insect pests started coming in, and then they started putting in more chemicals, more pesticide, more insecticide, which impact, and then people had to consume those vegetables. Obviously, that is a big health hazard. It reached a stage where the local mandi decided not to, or at least started thinking, not to, say, ban those vegetables from with the local, producing the natural insecticide, pesticides. This was 10 years ago. And from that stage of being banned from marketing their vegetables, they have now reached a stage where not only their vegetables are welcomed, they are being paid higher prices. So there is a big opportunity in adapting to the changes. So it is important to understand that climate change is very challenging, sometimes very depressing, but there is a plenty of opportunity to address that issue. And this is the example which I wanted to share. And the background information more for everyone to remember. Thank you.
Thank you, Nanji, for that very, I would say, a very direct and interesting example also, where the community actually took in charge, and they took the charge of how they can do the, basically it's more towards the resilience building, how they can adapt and actually also mitigate in the process the health impacts of insecticides as well. And interesting example from Davos, I think that's very true. We recently seen in Davos as well, and if students are following by chance climate change, so this was the first time in COP28 that the health was announced, and we know it has been working since the agreements have been there since which year? Any response? Anybody who has seen the video? No? Okay, we can come to the quiz later. Basically this was the first time, and it is very disheartening to see that the health is coming so late in the discussions even to begin with. So thank you for mentioning Davos as well. Now moving to the next question to Dr. Vidhya. So we have, like you said, there's definitely a vulnerability question involved here with climate change. So we see a lot of population, like you have studied with the workers and across. So which population you think are the most vulnerable to the health impacts of climate change? And what could be the, some of the examples of the measures which can be taken, whether at the grassroots level or at the community level to, to basically adaptation, in course of adaptation? Thank you.
Again, thank you. Again, I would say, like I said, temperature forms the basis of every living organism. So it's all again based on temperature, that's what I would say. When you're talking about vulnerability, who is most vulnerable? Somebody who is a child, whose thermoregulatory mechanism is not well developed, is definitely more vulnerable because they are not able to manage the temperature variations. Somebody who is exposed to more heat, whether it's at work or like a person who is like out in the streets, they are more vulnerable. Older people who are not again able to manage the thermoregulatory mechanism so much, who are immunocompromised, people who are not, who have other diseases that would make it difficult for them to manage the thermoregulatory mechanism would be more impacted. Pregnant women, they are not diseased, but again, like I said, a pregnant woman would have higher temperatures, body temperatures than compared to others. This is just part, the heat part, okay? But climate change is just not heat. Climate change is like variation in rainfall, precipitation patterns, humidity changes, right? And then the floods, all of that. Floods and everything are like outcomes of climate change, but people who are going to be impacted. Recently we had floods in Chennai. I lost my car, which is fine, kind of, right? One of my mentors in climate change, Dr. Kirk Smith, he's not there anymore. He was a Nobel laureate winner as well. He would say, the rich would find climate change to be a little bit unpleasant, little uncomfortable, probably a little bit colorless life. They have to adjust a lot, but the poor will die. Okay, that's exactly what happened recently in Chennai because of the floods. I lost my car. I know it's a little bit unpleasant. Commuting has become difficult. I have to fight with the insurance. That's fine, but so many people lost everything. Right? And then who are the people who lost everything? The poor and the vulnerable, right? So it's always the people who do not cause the climate change are impacted the most. I have probably 3 air conditioners which I don't use so often, like consciously I don't use it so often, but the people who are, and that contributes more to climate change as well, like carbon emissions and everything. But people who are living in the slums, who do not even have a fan, are the impacted the most. So it's definitely climate injustice. It's definitely difficult. Women are also impacted more when it comes to, there is always a gender thing. Women have to work twice as harder. One of the examples that I would give is, I did a study about women who are working in the metro rail, right? In Chennai, we are having a lot of infrastructure developments, and metro is being built. So I wanted to do a study because I see these migrant people, and migrants are again are very, very vulnerable. They come from Bihar or places where they could not cultivate anymore. Okay, they come. They were farmers. They are like excellent in farming. They know how to do farming so well because that's their thing. And they can't farm because there is water scarcity, there are other issues. So they all move out as families, come to Chennai because there is so much construction happening. But it is not their job. They don't know. They have to learn everything. And they don't have a cultural identity there. So they suffer. And then they still continue to work in these places. I see groups of people standing there, men and women separately. And this contractor would come. And again, this is climate injustice. Contractor would come. He will decide on that day how many people will have a job. So there are lines and lines of people, hundreds of people standing on the roads. And then they would be waiting who gets picked. So they are not sure whether they're going to get their wages for the day. Right? This is again a very, very indirect but direct effect of climate change. Right? People who had migrated, so just not the migrant workers. So what usually happens with these women, that story I started, these women who are working in the construction, in the metro, they would probably work from, let us say, 7 o'clock in the morning. In the construction, they start working at 7 in the morning. They will be working till about 1 or 2, and then they get a 1 hour break or something, and then they continue working. And then they're all put in temporary shelters. It's not their home. They come and work in temporary shelters. Temporary shelters with metal sheets. And they probably have a biomass stove that's going on inside the house. They go, and then they start cooking for their families. So they are exposed to heat and dust and everything, again, till late night. So they don't get a break from heat at all. So, like I said, many of these people, women, again, are most vulnerable, and their exposures are very, very high. So, like I said, think of anybody, when you go back today, look outside on the streets, people who are poor, people who are out on the streets, whether it's cold or heat, it doesn't matter. Whether it is rains or no rains, whether it's dryness or humidity, it doesn't matter. People who are exposed are most vulnerable, and some of them are a little bit more specially vulnerable.
Thank you. Thanks for that. And also, I think it was good to hear about, especially touching upon the climate injustice topic as well. So, climate justice, you also mentioned. Yeah. I think that is another important topic. Like you said, the most vulnerable, I think it's poor of the poorest. I think now I remember in 2016 in Delhi floods, I lost my car as well. But that's different, I would say. I think what is important is, like, all of us know, again, a question to the students. I think you should be able to answer this. What is the population of India? Which was like, okay, yeah, I can see some hands. You can shout, or you want a mic? Yeah, please, the boy at the end. You want a mic? Okay. Yeah, what is the population? 1 billion, yes, that's good. So is it the largest, or is it second in world population, or?
As of 2022, India was the second most populous country in the world after China, but in January 2023, India is the most populous country in the world.
Yeah, okay. And I think most of us know this answer. The reason I brought it, now you can imagine the stress that we have on our natural resources, and how we can actually, due to the human intervention, we can have these human-induced climate change effects. So just start thinking from that perspective is very important for students especially, I would say. Now moving to the next, especially to you, when floods were also picked up here, and I know ICIMOD and your previous work, you have been engaging a lot on the floods as well, and some of the solutions were early warning systems, specifically in Bihar and other areas, or any other solutions from your experience. You know, how these early warning systems and for extreme weather events will be improved to enhance preparedness and response in the healthcare sector. Like how we can actually link it with the healthcare. It's a little bit difficult, I would say, but then just wanted to know.
So recently, World Meteorological Organization, WMO, came up with some figures and data saying that if we protect our lives with early warning systems, we can reduce its impact up to 30%, by loss will be reduced by 30%. So, but half of the world countries, they are not protected by early warning system. And there's a call for that by 2027, all the countries should have early warning system. But when it comes to early warning systems in India or elsewhere, they are mainly big early warning systems. They give very broad projections of broader areas that this is what going to happen, a big cyclone is likely to come, which is important to know. But it is also important to know that quite often, a lot of damage happened because of the small floods. Floods in Assam, Bihar, very tiny flood in one river, and then it just inundates a few villages, maybe 10 villages, and that never gets into media. No TV channel will go and report that, but a lot of losses have happened. So to overcome this challenge, there is a solution, simple solution, which my previous organization, ICIMOD, worked on. It's called Community-Based Flood Early Warning System. And this system is very simple. It doesn't cost much money, but involves community at its core. This system is that the instruments are put very close to the river, almost on the river, and it has got a sensor. So as water table rises in the upstream in mountain areas, water table rises, it senses, and around nearby house there is a receiver. It receives the message automatically, and then that receiver passes on the message through mobile phones to downstream villages that water level is rising here. And then the downstream villages, they get alerted and they remove their assets, cattle, and themselves they remove from there because they get around 1 to 2 hours of lead time. By the time water reaches there, 1 hour before they know that water will be coming here, flood will be coming. So they remove most of the things. And then assets and sometimes lives also saved. So this very simple system, even it has gone to Malawi and many other countries based on our experience. And then the National Disaster Management Authority or state level disaster management authority, using this information, combining with the broader projections for the area, flood projections or any other projections, they come up with a very comprehensive, say, early warning systems. And again, in Davos, in World Economic Forum, floods are recorded as the most devastating impact on human health. So it is very much linked. So though we started as an environmental issue, but it is impacting the health directly. Because most vector-borne diseases, other diseases come after flood, they are because of the flood water which remains there. So this is one example which I wanted to share. Yeah, thank you.
Thank you so much, Nanji, for that. And it's also, again, linked with the, thank you, community-based adaptation approach, because I know for sure that it's not only a formal way of solution, it's also very informal when, you know, there are your friends and others upstream, the people you are already connected with informs you as well about the flood happening downstream. So just because of also considering the time, I just wanted to move to Dr. Vidhya. We have been, you know, another very important and interesting aspect to be discussed and at least to be, you know, highlighted here, especially among the students, is in what way does climate change indirectly affect mental health and well-being? in total, because it's again a very it's very difficult for a common person to understand the linkages. That is it because of the climate change, or so there must be some indirect linkages, and why the populations you think are particularly vulnerable to it? So thanks.
I'll go back to the same example that I gave earlier. People who migrate. Why do they migrate? Because there is water scarcity, the farms are dry, and then people are not able to cultivate. They lose their identity. They have to come and live in another state. I'm just talking about internal migration. International migration happens too. People from Kerala, people from Bihar, people from Nepal, they all migrate to Qatar and all these Middle Eastern countries, building their stadiums and everything. But they are toiling in like, what, 52 degree? And when they come back to their rooms, they don't even have air conditioning. And then so they are in the state of heat all the time. And how many of these people have kidney disease when they get back? There are thousands and thousands of workers who come back, 28-year-old man, 30-year-old man, 42-year-old man, comes back to India after working, thinking that, some economic benefits would be there by working, because they don't have work in their own farms. So they go and come back with a disease, right? They are like relieved of their jobs, they come back to India, or whether it's Nepal, and they live with disease and they have to go through dialysis. Many of them die. It has happened in Central America, it has happened in India, it has happened in Nepal. Migrant workers, like they are. And what happens to the families? Just not the worker, but the families. Mental health issues, obviously. Suicide, 60,000 farmers had suicide in the last 10 years. And because they are not able to. I'm just giving the example of a farmer because when we go out and have our lunch, we probably need to kind of from. This is exactly what is happening. I'm just giving you an example, simple example. That is just the tip of the iceberg. We have more issues coming because of climate change. My example, you know what? I was distressed quite a bit because I just lost one car. People lose everything. And then there is always some new term called eco-anxiety or climate anxiety that has surfaced now. Because it's all the time, people are always worried and people are irritated. There are like interpersonal issues between people, and all of this affects your diseases. Like people who didn't have hypertension now because they are stressed about things all the time. Where will I put the food on and when Mama Shamsa was telling, where do I have time to think about climate when I have to put food on a plate for 5 of my children, right? Same way, how am I going to protect myself, my family? That itself is a big stress. Okay, this is just one example. So there are lots of neurological issues, lots of other issues. For example, during COVID, how many people were very suicidal during those times, right? But there is always hope. That's what I want to tell the young crowd here. How did we fight COVID? We all did, right? And India rose so beautifully when COVID came. We were able to help others as well. So similarly, climate change is something that we can manage and we will manage, just not India, the whole world together. Different departments, different students adapting. Okay, he was giving an example of the organic farming and everything, renewable sources. Another important thing is like protecting ourselves at an individual level. The government of India or the World Forum cannot put an umbrella under the sun. We need to protect ourselves. We need to understand what is going to happen, and then with early warning systems, look out for signs, how to recognize these symptoms, and what we can do to protect ourselves at an individual level. And then the stress on the government is also less, on us also it's less, very less. So this is one of the things with when it comes to the mental issues, but this is, like I said, it's just a tip of the iceberg. So I think the farmer's example is something that the students can kind of digest better.
Thank you. Thank you so much, Dr. Vidhya, for that particular example. And also again, re-emphasizing on climate migration. I think this is a very important topic to be discussed maybe sometime later in course of next, maybe with the POP we can do that. Just one thing I wanted to ask students again, and I'm just, Ashita, I might take a little bit more few minutes. Just wanting to know, have you seen any changes in your holidays in the past couple of years? Yeah, please, yes.
Ma'am, few years ago it was very cold and the temperature was not very hot. But in this year it's very hot during the summer and winter vacation.
Yeah, so that's one. And any, she also wants to answer, any changes in the holidays? Yeah.
Last year when it was summer, it was very hot. And now when it's cold, it's very cold. Since climate change.
Yeah, yeah. So what we see and observe, sorry, we can take the responses later as well. Yeah, you can say from there, you can shout.
This year it is very smoggy, like last compared to the previous year.
Very good. So all kids are noticing. Yes.
Ma'am, after few some that we seen the in days so much hot and now at night so much cold, double cold.
Yeah, that's so true. So what we have seen is that now in schools, I think it's a phenomena which obviously we are, our age group and the senior can really relate to. We see air pollution holidays. We see winter holidays being extended. We see extreme heat waves holidays suddenly and extreme rainfall. And I think soon we'll have the flood holidays as well. So where are we going? We really need to relook. And just one more on that, my last question.
I just want to add
please.
little thing when the kids were telling about how climate change is making their lives a little bit tougher. And what's happening at schools is like, we used to have something called a PT period before. Even now I think we have. Many of the schools have like changed the timings. They are starting to have their PT periods between 8 o'clock to 9 o'clock because it's too hot for them to play outside. And then come back, their cognition goes down because their body is your mind and body is not alert enough or they're too fatigued to actually continue studying. So there is a lot of issues about temperatures and heat on cognition of the children. So it's impacting children in every way. There is another little kid who wants to tell something. Quickly. Yeah, my life is difficult.
Yeah,
that is right. Global warming, because of that, temperatures are rising in the winter, so there are different things that are happening in the environment. Flowers are flowering at the wrong time, fruits at the wrong time, allergens are happening, so there are lots of happening because of climate change, and we'll all do something together to make it a little bit better.
Yes, thank you. Thank you so much. And just my last question to both the esteemed panelists is on the global cooperation or any form of cooperation, and also some key message to the students that what needs to be done, how they can take care of it, especially now in the last segment when we talked about how it is affecting students' life directly and the youth as well. So any thoughts on that, Nanji?
Thank you again. I think in terms of, say, global cooperation, you are the best example. The POP movement itself is a best example that how youth across the world can come together and really try to see that how the problem can be solved. Apart from that, of course, there are several opportunities, several governments working on this, and they can work more. But if the youth power comes along with it, I'm sure the governments will be listening more, because the future, not only future, even the present belongs to you. You are the not only future leader, but I feel that you are the real leader at this moment. And big thanks to the young kids. One of the kids used the word double cold, and we as experts always struggle with what could be the simplest way of communicating this issue. And see how simple, double cold. Everyone will understand immediately, even journalists, anyone who talk to, yes, it's very cold, double cold. So it's just the the way impact can be communicated in simple language, that's what I learned today from you all. That's why I'm always interested in learning from you, interacting with you, and there's a good opportunity. So POP movement itself, make it stronger, make it bigger, so that governments really have to be forced to listen to you. That will be my message. And second will be, prevention is better than cure. Please prevent yourself from health issues, be careful, don't waste any energy, any food. And I have seen so many people, we talk a lot about climate change and we should be careful. But when it comes to our car, even when it is not running, we want to keep ACs on because we can't bear it. But let's put the habit of adjusting little bit, do little bit every day so that it is, at least the impact is reduced. And unless everyone does it, it's not going to change. And don't think if I do what difference it will make. No, it begins with oneself, so that will be another message. Prevention is better than cure, therefore try to prevent it as much as you can. Thank you.
My simple message would be like, again, I'll go back to my school days. We used to have one period every week, one period, 40 minutes for moral science. Right? What to do, what not to do, what is right, what not to right. We will have a story and then what is the moral of the story, right? So we probably need to have ethics in climate, ethics in the environment, and ethics on what to do and what not to do when it comes to climate. And climate change should be a part of the curriculum. And then innovation. One of the examples I would give is one student from deep South India wanted to, it's very hot nowadays, right? And then we have more number of hot days. I was telling my colleagues earlier, few decades ago in South India, we would say, we would have 15 days of very, very hot days. Now they call it as heat waves. Before they used to have hot days, and then we would have special diet during that time. We will not have the regular diet that we would have. Our parents would give us special diet like buttermilk, ragi, fermented rice water and stuff like that. Simple, but something that would protect us. But now the things have changed. Whether it's heat wave or not heat wave, it's either burger or like pizza. I'm just giving an example, not everybody eats that. Those are things that is going to be much more detrimental because you start to generate more heat inside the body to actually digest it. So we need to be cognizant of this fact that what is going to be good for us, right? And that's one single small message. I know you are all intelligent kids. Second thing is, like I was starting to tell the little story about this boy who found his hut to be very, very hot. He just had a fan, some water and some plastic containers. He made a local air conditioner in his own home with very little energy that needs to be used. Okay, so things like that, kids can be very, very innovative with what little they have. So I would request all the students, because the double thing, right? So sweet. So I like that students can think about new ways of things. When we were there, we never had this YouTube and all of these things. But now you all have. You have the mobile and the world in your hands. So try and see what you can do to innovate, to make things better. For not for you, but for others also. And disseminate it. Disseminate it, having infographics for people during summer. The schools can actually do programs for people who are going to be most vulnerable. Because we hear about vulnerability, we speak about who is vulnerable, who is not. But why did we learn all of this? To make sure we help them, right? So this would be my message. How can we make it better for others? And for ourselves too.
When Dr. Vidhya was talking, I just remembered one thing. All of you carry a water bottle with you to when you go to school? Yes? What do you do with the water which is left in the bottle when you go back home? And sometimes what happens? Always you drink it, or sometimes it gets wasted also? It never gets wasted?
No, sometimes. They are truthful.
Absolutely. This is what I wanted to hear, that if someone can put it into a flower pot, everyone can do it easily. You go home, any plant nearby, just pour it. This will be such a big contribution that if you accumulate all the water, you will see that how many liters of water is being used saved and being used by the plant. That's it. Thank you so much.
Thank you so much, Dr. Vidya and Nanji, for such an enriching discussions with the students. Do you have a question? We can't hear you. Can you just come?
In the routing time, when I go home, I just put all of the water which is left in my water bottle in the plants in the school only.
Okay, that's really nice. See, another example. So many inspirational examples we already have in-house, right? Now we'll be, so I would like to thank you, both of you, and it's been really a pleasure hosting you here. Thanks. Thank you. Yeah.
If I may please request you to be seated here only while we have some other speakers joining us. You can be seated here only. We have some other speakers joining us, and we'll want to felicitate all of you together in the end.
Okay.
That's right.
So we'll have a Mentimeter now. You have mobiles? How many of you have mobiles or no? Very rare, very rare.
Yeah.
Okay, so then how do we do, Ashita?
Okay, thank you, ma'am. Thank you, sir. Thank you, Deepshika, for this very interesting session, and thank you for the relatable examples and our young champions here. We didn't realize how much potential you guys have. So we now have a short quiz, but we scheduled it halfway with a digital phone device. But what we'll do is, Deepshika will have to divide it. Yeah. Let people who have the phones answer on Mentimeter, while we'll go back to the classroom style of having hands up from the students here. We'll project the questions here, and we'll want you to raise your hands on each of the options, or even speak up as needed. Sir, ये screen project कर दीजिए ये वाला.
You can.
Yeah,
so we ask them to raise the hands, and then that's how we.
Yes, people in the audience who have a cell phone,
So
you can go to menti.com and enter this code and enter your responses.
So raise your hands.
In the meantime.
Raise your hands or. Okay, speak, please. Yeah. Huh? Okay.
Dr. Deekshika, there's a request to also speak in Hindi for some students who don't. So if you could translate the question.
एक जवाब आया हमारे पास, प्राइम मिनिस्टर जी का नाम आया है, नरेंद्र मोदी, and और
Sonu Sood.
Sonu Sood. Okay, very good.
The people who have phones
Akshay
can go
Kumar,
to menti.com.
Good one. Akshay Kumar. Jackie, you said? Jackie Shroff. Yeah. Who else? International भी हो सकते हैं.
Please raise your hands. The mic is around here in the audience. You may even want to add a couple of lines कि वो करते क्या हैं, if you want to. Just.
Yeah, of course. Leonardo DiCaprio, yes.
Sonu Sood helped people in the time period of COVID-19.
Yes, that's why he's that famous.
Okay, so we maybe, so yeah, I think there we have got very, we have Ash Pachari also here. That's really nice. So, yeah, Greta Thunberg. So how many, do we get the percentage also?
No, this is just a word.
Okay. So yeah, I think maybe let's move to the next question. So which disasters are also amplified due to climate change? कौन से जो हमारे disasters हैं जो amplify होते हैं? Because some of the disasters.
We can take a raise of hands. So how many of you feel it's floods? Let's see a show of hands.
Floods amplify होते हैं climate change से. Okay.
Landslides. Okay. Everyone's read all the options, huh? Heat and cold waves. Okay, and all of the above. So
all of the above, yes.
This was an easy peasy answer.
Yeah. So I think what is important to understand, though floods and landslides is also very, very crucial, because it's also a human-induced, amplified form of, I would say, disaster. Especially the landslides, and if you go to the mountain areas, अगर आप जैसे पहाड़ों में जाएंगे तो वहाँ पे जो landslides होंगी constructions, roads वगैरह की वजह से, तो वो भी काफ़ी बढ़ जाती हैं climate change में. फिनोमिना से, और फ्लड्स इंक्रीज हो जाते हैं उसकी वजह से, बिकॉज द मोर, आई थिंक बेसिक तो हम सबको पता है कि पहाड़ काटेंगे तो क्या होगा. यस, थैंक यू. चलिए नेक्स्ट क्वेश्चन. Okay, this is a little tricky one also. So what is the main source of human generated carbon dioxide emission? Carbon dioxide तो सबको पता है, right? सबको पता है? हाथ इतने कम क्यों खड़े हैं? हाथ, please raise your hands. Carbon dioxide, teachers को भी पता है.
So we'll do a show of hands for the options once again.
Yeah.
Okay, so how many for transportation?
Good.
Then deforestation. Okay, there's a clear generating power and agriculture.
Right. Okay.
So we have clear two winners, and Dr. Deepika
Yeah.
can tell us the answer.
So I think the answer is correct, of course. So the percentage wise अगर हम देखें आंकड़े, तो transportation और generating power उसमें सबसे ज़्यादा use होता है और सबसे ज़्यादा emissions होते हैं, of course, क्योंकि हमारी demand बहुत ज़्यादा है globally भी. And then deforestation, पेड़ काटना, उससे भी definitely carbon dioxide बढ़ता है. And agricultural practices जो हैं वो काफ़ी हद तक not only carbon dioxide बल्कि methane emissions भी होते हैं. Next question. So which of the following health conditions is not influenced by climate change? I'm sure you guys will listen to
impact करती है.
Dr. Vidhya.
Do we have a unanimous answer?
I think it's unanimous. Broken bones.
Our audience is much smarter than our questions, huh?
Yeah.
We thought school kids, so we kept easy
Question
questions.
is not completed. The answer is yeah.
All right.
Okay, that's true, but I'm sure we might get into the state, and Dr. Vidhya can tell us if broken bones is associated with climate change or not. Okay. Yeah.
Yeah.
Must be.
In some way, all of it is connected, but clearly here, probably least connected here. Okay, the last question.
This is the last one. What term is used to describe the phenomenon where rising global temperatures lead to more frequent and intense weather events? Climate shuffle, temperature tantrums, climate whiplash, or weather roller coaster?
Again, let's do a show of hands. How many for climate shuffle? Only a few, okay. Temperature tantrums, go for a guess. Everyone relates to tantrums, okay. Climate whiplash, no
one.
Audience at all, like hardly two. Then weather roller coaster.
Okay.
Very few. What is the correct answer?
So the correct answer is the one which no one has chosen. It's climate whiplash.
Exactly. So this is a trick question and a learning one. The correct answer is climate whiplash.
Yeah, so just break it down.
Tantrums.
Climate whiplash, okay? So that's the correct answer.
Once you grow old, the tantrum remains when you are younger, and this is a seniority answer.
So yeah, I think now we're done.
All right. We come to the end of Mentimeter. Thank you everyone. This is great to have this participation, and nice to do it on a non-digital way and going back to the classroom way. Thank you for your great participation. I'm sure we all have learned, we've learned more than you guys, I think, today. Moving on to the next session, we have 5 youth speakers who've been youngsters who've been change makers in their respective geographies. We've called them all the way here, taking a break from their work, with whatever things they were doing, to come and share their journey, their experience with us. वो हमें बताएंगे वो क्या काम कर रहे हैं, कैसे काम कर रहे हैं. So आप सबके लिए, हमारे लिए ये information होगी कि हम भी ऐसे छोटे छोटे काम अपने daily basis में कर सकते हैं, जैसा कि यहाँ पे भी हमारे esteemed speakers ने बताया. May I first please call upon Ms. Jyoti Sharma. She is currently pursuing her BA at Government College Kishangarh, and she is a student of Hindi Literature and Political Science and works as a community youth leader at Magic Bus Foundation. Thank you, Jyoti, for coming here today. As a change maker, she wants to create awareness regarding pollution in urban poor areas. Now we'll hear from Jyoti. Jyoti, you may please have a seat. Please feel free to use Hindi and a mix of Hindi and English so that everyone understands. Thank you.
यहाँ जो भी मेरे साथी हैं उन सबको मेरा नमस्ते. मैं अजमेर राजस्थान से हूँ और मैजिक बस इंडिया फाउंडेशन ऑर्गेनाइजेशन है, उसमें मैं पिछले 4 साल से एज ए वॉलंटियर एंड सिविल कम्युनिटी यूथ लीडर के तहत काम कर रही हूँ। दूसरा ये है कि जिस एरिया से मैं आई हूँ, भारत की सबसे बड़ी मकराना जो मार्बल सिटी है, वो हमारे जहाँ मैं रहती हूँ उसे थोड़ा सा नज़दीक है, 25 से 30 किलोमीटर दूर है। तो वहाँ मार्बल की कटिंग होती है, उससे निकलने वाला जो धुआं होता है, उससे धूल डस्ट होती है, वो वहाँ के लोगों को जो ऑक्सीजन से वो लेते हैं उसमें बहुत ज़्यादा उनके शरीर को वो प्रभावित करती है, जिससे कि उनको सांस से संबंधित तकलीफ होती है। तो इस साइड इफ़ेक्ट्स होते हैं। हाँ, तो इसके देखते देखते, इसके चलते हमने वहाँ पाया कि उन लोगों में बहुत सारी बीमारियाँ हो रही है, तो उनको इसके बारे में नॉलेज नहीं था। लेकिन धीरे धीरे जैसे जैसे ये बहुत बड़े स्तर पर फैलता गया, तो मैं जिस NGO से साथ काम करती हूँ, फिर मेरे पास एक अपॉर्चुनिटी आई चेंज लूम्स। तो चेंज लूम्स में ये था कि मुझे क्लाइमेट चेंज से रिलेटेड वर्क करना था। दूसरा, मैंने उस NGO में ये पाया कि क्लाइमेट चेंज क्या होता है, मुझे लोगों को अवेयर करवाना था। तो मेरे पास ये मौका आया कि जो लोग इससे जुड़े हुए हैं, आई एम सॉरी सेकेंड ये कि मैंने पिछले 1 साल में क्लाइमेट चेंज से रिलेटेड वर्क किया है, और कच्ची बस्ती में रहने वाले जो लोग हैं उन्हें मैंने एजुकेशन के तौर पे 50 यूथ को मैंने अवेयर किया है स्टडी से, जो इनको बिल्कुल भी पढ़ना लिखना नहीं आता था, और हेल्थ क्या होती है, क्योंकि वहाँ कच्ची बस्ती में कचरा, चप्पल पहने बिना कैसे भी उनका चलना, वो बहुत छोटे छोटे बच्चे, 2 साल के बच्चे, 3 साल के बच्चे मम्मी पापा को देख के गुटखा खा रहे हैं, तो उनकी हेल्थ से बहुत। तो मैंने क्लाइमेट चेंज से जो वर्क किया वो किचन गार्डन मैंने डेवलप किया। किचन गार्डन में हमने सब्जियां उगाई, और वही सब्जियां जो इस गवर्नमेंट स्कूल में मिड डे मील में यूज़ आती है, तो उन मिड डे मील में वो जिस पालक उगाया, तो पालक से जो आयरन है वो खुद सब्जी उगाओ खुद खाओ, तो कहीं ना कहीं जो इंजेक्शन लगी हुई सब्जियां होती है वो उनसे लोग बचे रहें। और सेकंड ये कि थैंक यू मुझे यहाँ बुलाने के लिए। ये मेरा पहला स्पीच है स्टेज पे, इसलिए मैं थोड़ी नर्वस हूँ इतने लोगों के बीच में। और दूसरा, थैंक यू पॉप मूवमेंट, थैंक यू मैजिक बस, एंड आप सबको थैंक यू मुझे सुनने के लिए।
Thank you, Jyoti. You were excellent, and as you can see, you have been an inspiration for all our young friends here. Now, may I call upon Mr. Monjur Hussain Mundal. He has come from Assam, and he has completed his academic career in social work in 2012 and is now working as a DPM, District Program Officer, at the Board Clinic Project at CNS, supported by the National Health Mission.
First of all, thank you to everyone, and I am really feeling very privileged to join this program. Though this kind of platform is for the first time for me actually. So my name is Manjur Hussain Mandal from Assam, northeast of India. And in northeast there is a river called Brahmaputra. This is one of the 9th largest river in the world, and it runs 800 kilometers throughout the state of Assam. And it forms the 2,500 small river islands in this river. And this river island is the home of 2.5 million peoples. Geographically, these river islands are very isolated. Almost all kind of challenges are there, but one or two very prime challenges is like a flood and soil erosion, because flood and soil erosion that happens throughout the year in very frequent manner. And secondly, there is no any communication, like there is no road or there is no any like boat service in this to reach this shore area. So even socio-economic condition of this community is very deplorable, and the education is also very low. But one of the very prime concern of this shore area was the health, because this community where the health service were not reached. So people were unable to access these health facilities. So this was the great concerns of this, even the government and the locality also. And it has seen the many significant changes or impacts that happens due to the climate. That's why this climate sense is very relevant to our works actually. And what kind of health challenges we have seen in these areas is like, first I would like to highlight 2 or 3 what we observed in this soil area. Primarily, very principally is the premature delivery, then the people migration due to this flood and soil erosions, and then like the low birth weight, and anemia is very common in this soil area. Last year in as per our records, out of 500 pregnant women, we registered, and out of that 507 pregnant women are very severe anemia, means their hemoglobin level is below 7. So this was these were the kind of concerns in the soil area. But one idea has developed by Professor Sanjay Hazarika. He is a renowned journalist. This boat clinic. It was started in 2008 in the river Brahmaputra, and each boat are equipped with all necessary medical instruments, including 2 doctors and the pharmacists, laboratory technicians. Means every primary facilities is there. So people of the shore areas, they no need to go in the mainland area. Even this kind of like dropout and left out what was happened in the earlier. Now there is no this kind of any issues. Now we have 15 boats, this kind of boats in 13 districts across the state. And we are serving in every year, last 22 and 23, we treated 2,14,000 patients. And out of that, but still migration is a very concern for us due to this frequent soil erosion. This was not happened in the earlier, but in very recent 2-3 years due to climate, this kind of soil erosion is happening. And as a consequences, people are bound to settle in, they are forced to settle in another place, which is very difficult for us to trace the pregnant women and this immunization, routine immunization children. But we are fighting, and we hope and we feel that this is the main battleground for us, because every kind of challenges are there. So we feel very privileged that we are fighting in the main battlefield, and hope we'll success more. Thank you.
Thank you, Manjur. Thank you so much. This is indeed a great initiative. May I now call upon Purnasha Pany. Purnasha has completed her graduation in sociology from Ramadevi Women's University and masters in sociology from Utkal University, Bhubaneswar. Currently, she is working as research analyst in an international project titled Economic and Health Impact Assessment of Heat Adaptation Action Case Study in Bhubaneswar. She will tell us more about her project, her work. Welcome, Purnasha.
Very good afternoon to one and all present here. My name is Purnasha Pany, and first of all I would like to thank the Pop Movement Group and Population Council Institute for providing me this opportunity. I am basically here to represent my organization, Development and Environment Futures Trust, which is in Bhubaneswar, Odisha. So the research project that I am currently involved in is basically in the domain of heat and health, where we are focusing on 3 vulnerable groups, that is the school-going children, the senior citizens, and the outdoor workers. And I can say that there is increasing evidence that climate is changing rapidly, and its impact has been significant enough to endanger human health. And a thorough review of articles revealed 9 climate change events, of which heat waves and extreme ambient temperature were found to be closely associated with the most cited illnesses. So heat stroke, heat rash, heat cramps, heat exhaustion are the major heat-related health impacts affecting the vulnerable population. So take for example, we as individuals, or even I myself, when our cities record a temperature of around 45 degrees Celsius during summers, don't we feel dehydrated, tired and dizzy? Even then we have the option to stay back indoors. But what about a construction worker who is bound to work outdoors in the scorching heat, and a house help who has to walk several miles to do her duty and again has to come back to do her own household chores? Isn't their health impacted due to heat? Yes, it is. So to address these health illnesses and to prepare and to recover from extreme heat events, most of the states have come up with the heat action plans. So there are a total 37 heat action plans in India, and of these, Odisha state implemented its heat action plan as early as 1999 after witnessing 2042 heat wave deaths in 1998. So in my project, we are trying to reach out to these vulnerable groups, that is the senior citizens, the school-going children, and the outdoor workers, where we are trying to tell them how to efficiently cope with heat so that new interventions can be made, such as I can say on the basis of my research findings that one of the affordable solution is cool roofs. A cool roof is a white reflective roof which remains cool in the sun and which can bring down the indoor temperatures. And other certain measures that can be implemented are the green infrastructure, such as improvising the urban landscape, roof gardens and green zones, urban parks. And like that, there are some blue infrastructures, such as investing in water bodies, wells, and fountains in areas of mass presence, etc. So other measures, apart from this, more importantly perhaps, we need to have behavioral measures that are aimed at producing a certain kind of behavioral change on the part of the exposed population. Such measures can be developing labor guidelines, restricting tourism, and shifting work timings away from peak heat exposure, school operational guidelines, etc. So I can say that particularly for these behavioral change to happen and for these structural changes to be utilized, a lot of awareness building has to be generated among these vulnerable population, which can be achieved through a variety of ways, as you all know, through radio, television, or the smartphones in which we receive early alerts. And likewise, in our state, in Odisha, the Odisha State Disaster Management Authority has developed an application named Satark, in which the people receive early alerts, the heat wave alerts, and early warning information so that they can efficiently cope with heat. That is all I can say. Thank you so much for this opportunity, and through this project, I am looking forward to learn more and more and bring about some changes and to make people, these vulnerable groups, aware how to efficiently cope with heat. Thank you.
Thank you, Purnasha. I know everyone's hungry. We have 2 more speakers, 10 more minutes, and we wrap up the session. So just be with us for 10 more minutes. Calling now Mr. Pawan Kumar. He's currently pursuing his MA in Sociology from University of Lucknow. And he has been engaged with Be a Jagrik program on constitutional literacy. So welcome. Please talk about your experience with us.
नमस्ते, मेरा नाम पवन कुमार है और मैं लखनऊ उत्तर प्रदेश से हूँ। मैं जैसा कि अभी बताया कि लखनऊ विश्वविद्यालय से मास्टर ऑफ सोशियोलॉजी कर रहा हूँ। क्लाइमेट चेंज की जो मेरी यात्रा रही है वो मैं कभी इस फील्ड में नहीं आने वाला था, मतलब एक पढ़ाई का पूरा एक टारगेट था कि चीज़ों को लेके। तो हमारे स्कूल्स में एक बार ये हुआ कि एनएसएस वॉलंटियर्स होते हैं, शायद आप सबके स्कूल्स में भी होते होंगे। तो हम लोगों को एक टास्क मिला जिसमें हम लोगों को अपने अलग अलग स्टूडेंट को अलग अलग टास्क दिए गए थे। तो मुझे उसमें अपने डिपार्टमेंट के वॉशरूम को 1 हफ्ते तक साफ करने का टास्क दिया गया। और उस दिन मुझे पता चला कि हमारे खुद के डिपार्टमेंट ऑफ सोशोलॉजी के जो वॉशरूम्स हैं वो इतने अच्छे नहीं हैं, खासकर फीमेल, क्योंकि हमें दोनों वॉशरूम साफ करने होते थे। तो ये हेल्थ इशू जो हमें एक सामने आया कि ये जो प्रॉब्लम्स हैं, इसके साथ में एक संस्था लखनऊ में है, ये एक सोच फाउंडेशन, यस के नाम से हम उसे जानते हैं। मैं उससे जुड़ा और उसके थ्रू मुझे चेंज मेकर्स जर्नी CYC जो कि प्रभा लखनऊ ये संस्था है दिल्ली की, वो हर साल युवाओं को जोड़ने का काम करती है जो क्लाइमेट पे काम कर रहे होते हैं, अलग अलग फील्ड में क्लाइमेट से रिलेटेड। तो हम सभी लोगों ने, हमारे साथ पूरे ऑल इंडिया से 28 स्टेट से लोग थे, और मेरा जो प्रोजेक्ट था वो ये था कि हमारे पास तकरीबन 20 किलोमीटर दूर BKT बख्शी का तालाब एक गांव है, वहाँ पे बच्चों में सबसे ज़्यादा फूड पॉइजनिंग और खाने से संबंधित बीमारियों को देखा गया। वजह ये थी कि बच्चे जो स्कूल के थे, क्योंकि वहाँ पे स्लम एरियाज़ के लोग ज़्यादा थे, तो वो क्या करते थे कि चीज़ों को, और आज भी हम जब हमें भूख लगती है तो हम दाल चावल की तरफ नहीं भागते, हम बर्गर पिज़्ज़ा की तरफ भागते हैं। इसलिए, और ये हमें पता है, ऐसा नहीं, एज अ यूथ हमें पता है ये सारी चीज़ें, उसके बावजूद तो मैंने अपनी जो यात्रा स्टार्ट करी वो एक कम्युनिटी से स्टार्ट करी जहाँ मैं जाया करता था, उन स्टूडेंट को पढ़ाया करता था। मैंने उनके साथ सेशन लेना स्टार्ट किया क्लाइमेट के ऊपर कि एग्जैक्ट क्लाइमेट और हेल्थ को हम कैसे जोड़ सकते हैं, उनका मतलब क्या है। क्योंकि हम क्या करते हैं, हम शहर में रह के गांव में स्टार्ट करते हैं, और या गांव से रह के हम शहर में स्टार्ट करते हैं, मतलब हम जहां रहते हैं वहां से स्टार्ट नहीं करते। और हमें इसीलिए लोगों से अपनी बातों को बताने में, समझाने में प्रॉब्लम्स होती हैं, और शायद हम एक अच्छे रिजल्ट तक नहीं पहुंच पाते। तो इसलिए हमने सीड्स कैंपेन किया। हमारा एक मोटिव था कि हम हर घर में सीड्स दें। सीड्स मतलब सब्जियों के बीज। हम हर घर में जाते थे और सीड्स कैंपेन करते थे। हमारे साथ हमारे गवर्नमेंट स्कूल्स के यूथ हुआ करते थे, हमारे साथ स्लम्स एरियाज़ के यूथ हुआ करते थे जो स्कूल्स नहीं जाते थे। तो जब मैं सीड्स कैंपेन कर रहा था तो मैंने स्लम एरियाज़ के स्टूडेंट के साथ देखा कि वो इन एक्टिविटीज़ को लेके ज़्यादा वो हमारे साथ जुड़ रहे थे। और जब हम स्कूल्स में सेशन लेते थे तो युवाओं में ये मैंने पाया कि वो उनके अंदर अवेयरनेस जो है वो काफ़ी एक अच्छी है और काफ़ी उनको समझ क्लाइमेट के ऊपर है। हम यूथ जो पढ़ रहे थे और जो स्लम्स के थे उनके साथ ये कैंपेन स्टार्ट करी। अभी मैं तकरीबन 4 गांव को लेके इस कैंपेन को कर रहा हूं, और 100 हमारे पास जो स्टूडेंट हैं वो पूरी तरीके से हमसे जुड़े हुए हैं। वॉलेंटियर्स हमारे पास 10 हैं जो हर एक गांव में सीड्स कैंपेन करते हैं। हमारे पास कुछ पोस्टर्स हैं, वो हम आई थिंक शायद नहीं दिख रहा है, तो फोटोज़ हैं, वो हम अपने जो हमारे वॉलेंटियर्स हैं उन्हें देते हैं। और सीड्स, किसी को भी सीड्स चाहिए होता है या लखनऊ बेस्ड सीड्स चाहिए होता है, चाहे आप अर्बन एरियाज़ में हो चाहे आप रूरल एरियाज़ में हो, देन हम लोग उसे प्रोवाइड कराते हैं। तो ये मोटिव हमें इसलिए आया क्योंकि हम भी जंक फूड कभी ना कभी खाते हैं, खाना पड़ जाता है, ऐसा नहीं है। तो उन चीज़ों को, क्योंकि हम नहीं चाहते कि हमें उस तरीके की फूड पॉइजनिंग हो जो हमें उस कम्युनिटी के लोगों में देखी गई। और एज अ यूथ ये हमें अपनी जिम्मेदारी को बखूबी निभाना होगा, क्योंकि ये जो आने वाली पीढ़ी है वो हमारी है और हमें ही उसे सही करना है। हम सभी क्या करते हैं कि ये जो इंस्टाग्राम पे रील्स होती हैं तो हम उन रील्स को स्क्रॉल करते जाते हैं, चाहे वो क्लाइमेट से रिलेटेड हो, चाहे वो ग्लेशियर पिघलना हो, चाहे वो समुद्र तल का गिरना हो, हम ध्यान नहीं देते। और इसी वजह से एज अ यूथ में बस एक चीज़ को अपनी बात को ख़त्म करना चाहूँगा, और यही है कि मैं नहीं तो कौन, अगर हम लोग नहीं जागेंगे तो फिर कौन जागेगा, कौन ये काम करेगा, और अब नहीं तो कब. सो थैंक यू सो मच.
Thank you, Pawan. Thank you so much. Without taking any extra time, may I now call upon Mr. Akash Mishra. He is working as a youth climate champion at the Restless Development India and pursuing economics at Azim Premji University, Bangalore. He's been working in the field of climate change for the last couple of years, and he's here to share his experience with us. Welcome, Akash. He's our last speaker, and then we will break for lunch.
Hello everyone, thank you for calling me on the stage, and it is my pleasure to come here and speak about my work. So currently I'm studying in Azim Premji University in Bangalore, and I'm working at Restless Development India, where we have selected a community in Bangalore which in that community we focus on providing education and advocacy about climate change, and then we come to a ground level understanding of what has been affecting them, and then after like doing a proper survey of that community, talking to the people and stakeholders there, we got to know that solid waste management has been a very like key issue there, which has been affecting them like with their health and with the other things that they like to do in that place. So when we visited that place, there was too much chaos about where to go, like garbage is being thrown, and then there's the truck which collects the garbage was not very frequent, so the garbage was collected in front of their house. The drainage system was not proper, so there was a lot of water stored in front of their house, which was affecting their health, and children used to play around that space, and it had got them many times they will fell sick, and then the lot of increase of vector-borne diseases over that area. So we thought to create advocacy about their rights, about their health in that particular community, and then we tried to hold a workshops there. We went and held a workshop in schools and nearby areas, teaching them about waste segregation and families about how they can segregate their waste properly so the littering would stop, and then they can also like try to educate their own children and others in the school to like stopping them from throwing plastic waste and try to recycle most of the products they have it. And then we also conducted a lot of camps where we try to like avail them the government schemes which help them for their health and the insurance, where they can we help them applying those schemes like ABHA card, which is like in Karnataka. We help them there in Bangalore, like applying for those cards, and then other insurance things that have been provided by the government. Throughout this last 2 years, I have been doing a lot of cleanliness drive in the communities in Bangalore, and then providing them a lot of materials and webinar or workshops or camp, which might help them and like educate people about climate change and the effects related to it. Thank you.
Thank you, Akash. Thank you, everyone. Thank you for taking out time. A special thank you to all the students who are here on a Saturday. We've moved to the last bit of this technical session. May I now please request Dr. Soumya Ramesh, Executive Director, Population Council Institute, to come and felicitate our esteemed speakers, Dr. Vidhya and Dr. Agarwal. She'll do. Calling Dr. Niranjan Sagurti, Country Director, Population Council, to felicitate our young change makers who are here from across the country. Dr. Niranjan, if you could felicitate Jyoti. Mr. Monjor. Akash. May I also call upon Dr. Nand Kishore Agarwal, Deputy Director, Population Council Institute, to felicitate our young speakers. If you could first felicitate Purnasha. I hope I'm saying it right. And Mr. Pawan. Please join them for a picture. Soumya and Niranjan, please join them for a picture. Join all the guests for the picture. So as this technical session has come to an end, we've all learned from each other. We've learned more from our young friends here. And all we've understood is that climate change is not going to be driven by any big policy or any big sudden movement. It is something we have to do every day, each and every one of us, at every step of our life in whatever we are doing. So thank you for coming here, giving us your time.